This is Black Mental Health Matters. I'm Dr. Carryann Williams. I'm a psychiatrist practicing in Massachusetts, and this is a podcast about everything related to mental wellness in the Black community and beyond. Today, my guests are students at William James College. Let me introduce you. First, we have Ellie Deveaux. Ellie is a fourth-year Doctor of Clinical Psychology student at William James College. She works with children, adolescents, and their families in individual and family psychotherapy. Ellie's research interests include working with transgender and non-binary youth and their families, as well as increasing access to neuropsychological assessment and care. Next, we have Sonia Cordero. Sonia is a second-year Doctor of Clinical Psychology student at William James College. Sonia has clinical experience in a variety of settings and has witnessed racial disparities in access to healthcare in the Hispanic community firsthand. She hopes to be an agent of change for underserved communities and to increase access to neuropsychological evaluations. Welcome to the podcast, Ellie and Sonia.
Thanks for having us.
Thank you.
So today you guys are going to be speaking with us about disparities in access to a type of specialized assessment called a neuropsychological assessment. But first, I'm curious to know a little bit more about your interest in this area. Tell us a little bit about yourself and what led you to this work.
Sonia,
go ahead, Ellie.
You can go ahead, Ellie, first.
Okay. So I'm in my fourth year of this program, and we are in the field doing work from day one. And so in the past 4 years, I've had exposure to conducting this type of assessment and interpreting this type of assessment, recommending neuropsychological assessment. And throughout those experiences, many of the disparities that we see throughout the mental health field have become very clear in the neuropsych space as well. And then in the past 6 months or so, I have joined a research lab specifically looking at increasing access to this type of assessment. And I can talk about that a little bit later.
Great.
Yeah. In my case, I'm working in the school area too. I can see how is the big need for the Hispanic neurological assessment and the lack for the clinician and all this stuff. And this is a big gap as a Latina or also the Black population. Sometimes they don't have the really assessment that they really needed.
Right. And what is a neuropsychological assessment?
It's an excellent question. Yeah. A neuropsychological assessment looks at someone's cognitive, behavioral, social, academic abilities. So when you're looking at, let's say, someone's cognitive abilities, I think a lot of people think of like IQ testing and but really, in cognitive testing, we're looking at things like memory, working memory. So how do you hold real world things in your head, like memorizing a phone number or directions, other things like organizing and planning, vocabulary, or your verbal abilities, nonverbal abilities. We're looking at a lot of different things, and you can have both comprehensive neuropsychological assessments in which you have a large battery, so a lot of different types of tests that are looking at each of those buckets. So you might have one for cognitive, you might have one for verbal abilities, you might have one for academics. And then sometimes neuropsychological assessments might be more targeted. So you might come in with a very specific question or problem, and then you might go from there and have some tests that are specific to that specific question.
And it sounds like, when you said, memory testing, is this something that only older people might get? Like who gets a neuropsychological evaluation?
It could be child, it could be adolescent, it could be person, adults with dementia. It could be that kind of population. In other words, if for all person who is in need, that it's no matter is a child or is a adult.
Sometimes, if I can add, sometimes exactly that. It can be across the board. And so sometimes you'll see it in a hospital setting where someone has had a traumatic brain injury and they're looking to assess their functioning after that event. But I mean, it really can be across the lifespan. Oftentimes when you're looking at a younger child who's getting recommended for a neuropsychological assessment, there's something going on at school, at home, that's being flagged.
Maybe ADHD, autism. Yeah.
And so how would a parent know that their child needs an assessment like this?
Yeah. Most of the time, maybe the parent don't even know, but a school person from school or doctor, pediatric, they are the person who is concerned with something that is not clear, and that's why they made the referral.
Okay. So someone working with your child might say, I think your child needs this specialized assessment. And then they'll tell the parent that they need to kind of look into that.
Yeah. Also sometimes maybe the parents notice something weird in the child, and they can maybe talk with the doctor and they make the referral to you.
Oh, okay. And so, one of the things that you guys have been studying is disparities. This idea that not everybody gets what they're supposed to get. And so tell us about, what happens with these assessments and who's getting them and who's not getting them.
Yeah.
Right, Ellie.
Yeah. This is obviously one of our biggest focuses that we've really been thinking about, is really who is not getting these assessments and who is getting these assessments sooner, or who is getting these assessments. We see a large gap between the amount of time it takes to get a referral or even to start thinking about this process. And we could talk a little bit more about that. But in terms of like who really is getting this, we're looking at, the landscape, at least from where Sonia and I are both in the Boston area in Massachusetts. And many times the wait to get a neuropsychological assessment can be anywhere from maybe a year is good, but it can be up to 2 years or longer.
Or 3.
Yeah, or 3. And so, and that's if you are going to be using insurance. And so the other option is you can pay out of pocket for these assessments. And so the people who can get these assessments sooner are those who can pay $5,000-$6,000 for an assessment,
right,
and get in within a couple months, which is a much, much shorter time frame when we're looking at months compared to years to getting these done.
Mm-hmm. Mm-hmm.
Wow. So the first disparity is financial. Is if you don't have the money to pay out of pocket, you could be waiting up to 3 years for your child to get an assessment that they need for their quality of life and for their health. But if you have $6,000 out of pocket, you can pay someone in private practice and get an evaluation within months. And your child gets the recommendations that they need, and you get to kind of move forward with what you need to do.
Yeah. And when we're talking about the Hispanic population, the thing is going more worse. Why? Because most of the people for example, in the Boston area, is a lot of person, they immigrate to Boston, right? And they don't have maybe insurance to pay that. And also, they doesn't speak English. So this is another issue, because the neuropsychological assessment is most in English. And also, they don't have translator. And this is another issue. Even they have translator, still having a problem, because at the time when they try to translate, it's gonna lose the meaning of the evaluation. So yeah, it is very complicated.
So there's kind of more layers. So one layer is the weight. The second layer is the language that the assessments are in. The other layer is if you don't have insurance and you don't have money out of pocket, what do you do? Mm-hmm. And then the validity, which is something I know you guys will talk about, is the actual validity of the test itself. If someone is having to translate or interpret the language and kind of convert it to someone else's language, is the instrument still valid?
Exactly.
Something I think about, I remember talking to a psychologist about this, is that, and I'll say for our listeners, all of these tests that are in a neuropsych, they have to be basically standardized. And in order to standardize a test, you have to test it out on a population of people and then test that it is, in fact, kind of true. So if the test says that the person has this condition, they really have this condition, they have to test it on a group of people. Well, then that test is only valid for the group of people it's tested on. So that test is only validated on a group of middle-class white boys, and that's the test is mostly true just for them. And if you try to administer that test to a young woman of color who English is not their first language, we don't actually know if the test is valid for them. Exactly. We don't have a choice but using it. And so there's kind of all these layers of why these tests are kind of problematic. You guys talk a little bit more about kind of what you guys are finding.
Right.
Well, man, the layers, you're peeling back the onion. It's pretty deep. Like there's a lot of different disparities, to the point that even when we were trying to name all of them, I mean, the list can get fairly overwhelming. So one of the pieces, an additional aspect of this disparities is oftentimes one of the places that kids can get tested is in schools. And typically in Massachusetts, school districts and various individual schools will have a school psychologist on staff who can do academic and some basic neuropsychological assessments. The problem with that is that better funded, primarily white districts have more school psychologists to access these services, whereas other underserved and less funded districts are not going to have those types of services. And so it increases the disparity in access when you're looking at even just the number of school psychologists, which is a specific bucket for neuropsychological assessments, because again, some of the kids, like Sonia was saying, the early identification can happen in school. And so oftentimes schools can refer to do an initial test. But if you have one psychologist to 1,000 children, it's going to take some time to get there. And so again, that's another piece of this.
Yeah. For example, I remember when I was in a school working as a clinician in a school base, I remember a case, especially for a little boy. That boy have a lot of issues, and I was looking for any Hispanic clinician practically in all Massachusetts area, and I don't find anyone. And 1 year passed, second year passed, not even the school can find anyone, any psychological assessment, until I find one in Lynn, Massachusetts. Lynn, Massachusetts, from the area that he lives is almost 3 hours. Wow. So he has to travel 3 hours just to see that person who speaks fluently Spanish, and he's a very, very, really great doctor doing the neuro evaluation assessment. All this just for him to be able to qualify for some accommodation in the IEP. So it was crazy.
So there's a disparity in representation as well. So who are the people doing neuropsych assessments? What languages do they speak? What is their cultural background? How do they see the kids that come to them? How do they understand their issues?
Right. And this is another issue. It's another layer. Why? Sometimes when you find a neuro psychology Spanish, what happens is the kids don't have insurance, or the insurance don't want to pay for that kind. That it's it's really disparity.
The insurance is a big piece of it as well,
Yes.
is what's getting funded and what's not, especially by our state and health insurance, mass health. The reimbursement rates are very low. It's difficult to get an approved referral.
Right.
And like Sonia was saying, it takes time, and there can be a language barrier for many children. This is a field that I think is working generally, like the field of psychology is it working towards diversifying racially, ethnically, linguistically, but has some work to be done for a very, very long time. And arguably still is dominated by one narrative.
Yeah, and not to get too in the weeds, but for our listeners, there's different kinds of psychological assessments, and so sometimes your child may have access to one, but they actually need the other kind, and so your school might approve an assessment, but then the assessment they get at school is really just to talk about school accommodations. And they may need an assessment to test for autism or to test for something else. And it's not just about school accommodations. It might be about clarity of their diagnosis or to kind of make some other recommendation about their treatment. And so, yes, maybe you get the school assessment, but the school assessment isn't going to give them a diagnosis. And so then if you want to get the top-notch one that tests for autism, you may have run into trouble getting that paid for. Or even for ADHD, sometimes definitely insurances don't cover testing for ADHD.
I was just going to talk about ADHD a little bit because that's a big one. It's very hard to know sometimes when you have a young child, let's say in first or second grade, who's not learning how to read. It might look like a learning disability or a reading disorder, but it also could be something attentional like ADHD, and that's much harder to get tested for in a school environment. In fact, I'm not actually sure what the line is there for even schools to be able to attest for ADHD, but I do believe you need to schools can't do that level of testing for ADHD or autism. They really are doing school-based testing. And so that can be really challenging, right? If a kid is not learning to read and we're not really understanding what's actually at the core of what's happening for them. We could give them extra services. We could write in all these wonderful services for them to get in a school. But if really the problem is ADHD, then we should be looking at another type of intervention.
Yeah. And now, before we move on, I want to make sure that we explain to the listeners what the neuropsychological assessments are used for. What are the kind of recommendations that come out of this, and how are they helpful to people? How can they kind of change your treatment trajectory?
I'm happy to jump in there if you want, Sonia. The first couple things that come to mind, oftentimes a neuropsychological assessment can be an incredible tool to understand your own strengths and weaknesses and what areas you're strong in versus others. Just generally, right? How do you learn best? What are ways that, maybe it helps you to have things written down? Maybe you just know that it takes you a little bit longer to process information. Maybe it's you understand things. It takes you a little bit longer to understand things that are spoken to you, but you can understand things written down or that you read. So generally understanding strengths and weaknesses is a pretty wonderful tool to be able to get from that. I think something else you can get from a neuropsychological assessment is you can get some diagnostic clarity. So you can really, if someone's coming in with a specific problem, we keep talking about ADHD or attentional difficulties, but it doesn't have to be attentional. There can be a lot of different things that might be going on. There and oftentimes I think the field, as many people know or don't know, but oftentimes we're not just looking at one single diagnosis for something. Oftentimes, many different pieces of someone's cognitive, social, academic worlds are coming into play. And so it can really help tease apart what's happening and understand, we understand this through a diagnosis. And once we have that, then can we maybe treat this or support this in various ways?
And I think I know in psychiatry, that's probably one of the top ways we use it is for diagnostic clarity. If somebody, we're not sure if maybe what they're experiencing is psychosis or autism or, this sort of thing. And talking about culture, I'm curious to hear what you think, Sonia, because I know sometimes when we get people that come to us and they're from other cultures or other languages, and we're trying to sort out some symptoms that they're having, and someone says, "Oh, I think they have bipolar disorder," or "I think they have psychosis," or "I think they have autism," and then another person says, "Oh, I think they're just a bad behaving kid," And I feel like these tests can help to kind of validate for parents that there's actually just something medically that maybe needs to be treated, or there's just something psychologically that needs to be treated with therapy. And so, Sonia, when you're talking to folks in the Hispanic community about these assessments, how do you explain to them what they're used for, and kind of how do you talk to them about these assessments?
Well, when I with the community, and before, let me make clear that point. You made that excellent point about psychosis, about how sometimes it can be misdiagnosed, all this stuff. Because I remember one case that I have, and that boy, he have a attachment issue, and I remember he was at school very hitting the professor and a lot of issues. And I remember that I sit down with the parent and I try to explain the benefit for the neuropsychological assessment. But one of the things that they don't want it to do that is because they say that assessment is for crazy people. And I try to explain to them it's not for crazy people. It's just to make sure that everything is okay, or what is how we can help your kids. And then one of the things that I noticed is that assessment sometimes is really made for white people, and not for like Black or Latino, because this is a big issue, because can result in low test or a score, or no English speaking individual. They can misunderstand our culture. So I try to explain the parents that it's a benefit, and that is why they're important to get someone who speak Hispanic, because this is another issue. Sometimes they try to put a person who translate during that assessment. But what happens is, even the people that speak the same language, Hispanic, is a different country. And one thing can have a different meaning. And that can be very hurt the results or the score. So most of the Hispanic population, sometimes they are scared to that, to the neuro evaluation assessment, because they, in the past, they have a really bad results. So.
And Sonia, do you, with your experience with doing these tests, is it that sometimes since the tests aren't necessarily always designed for people for whom English is their second language, or maybe from a different culture, is the test likely to not pick up that there's a problem, or is a test likely to diagnose a problem where there isn't, or are both things sometimes a problem?
Yeah, it could be both things sometimes. It could be sometimes. Sometimes we can just want to clarify a diagnosis, or make sure that this is like you explained before, psychosis, is adult or something like that, or just to make sure that the ADHD or whatever is the case. Yeah.
Okay. And now, Ellie, you're doing some kind of research project to help people gain access to neuropsych assessments. Can you tell me a little bit more about that?
Yeah, absolutely. So I'm part of a research team at Boston Medical Center. It's called the Integrated Psychological Assessment Services, IPASS. And what they're doing there is they're actually very successfully doing it, but they're integrating neuropsychological assessment into primary care practices.
Oh,
So instead of having to wait, again, like those wait times we were talking about, which can be very, very long, for this most recent pilot that they did, which was looking at ADHD testing specifically for children in pediatric primary care, you were looking at 1 to 2 months for a testing done in a primary care setting. So access was much, much quicker. And so this follows a trend that we're seeing in the field of trying to integrate more services, more behavioral health, mental health services into the primary care setting. And the hope is that using this model of integrated behavioral health into the primary care setting, we can also integrate neuropsychological assessments and get them to be just like Sonia was saying, right? There's a lot of stigma in many communities around getting these testing done. It seemed like, why would I get this done if I don't, this is just in your head or something, there's so much stigma around any sort of challenge like that. And so some of the research finds that if it's integrated in a primary care center, if behavioral health is integrated, people find it easier to access. It's sort of a one-stop shop, right? You're going to get your blood test, you're going to get your blood drawn in the same place where you might get tested for ADHD or autism.
Now, are these tests going to be like abbreviated, or are they getting full neuropsych testing?
In the current iteration, it is specific to when there's a question about, this is ADHD specific right now. So the hope is to expand this project to sort of show the feasibility, show the validity, show the reasons why Boston Medical Center and other hospitals should invest in or other primary care centers should invest in a service like this. Why does it work? So right now, what we're seeing, and what I see right now in my clinical practice, I'm at another hospital in Boston, and we very frequently, a child, even adults, might get diagnosed just off of a screening questionnaire. So they've developed these questionnaires. They're probably like 20 to 30 questions. There's questionnaires for everything, depression, anxiety, psychosis, ADHD, autism. And oftentimes what's happening is pediatricians or Dr. Williams, I'm curious if you see this in the psychiatry world of just, we give these assessments, they fill it out. If it screens positive, the trend or the common thing is to say, okay, maybe you probably have autism, you probably have ADHD. And it's really just based off of this one screener and an intake interview or some sort of diagnostic interview. And so the precipice for this research was really, okay, is this actually accurate? Like, is giving, and the specific question was, if you're giving a Vanderbilt, which is a ADHD screener, to a child, how accurately can that really diagnose in a primary care setting? And we're finding that it's probably not super accurate without some diagnostic testing being done. Again, the research, this research is in its infancy, so it's early, but the early research is showing that this is a really cost-effective, accessible way to get accurate diagnosis.
And is that going to be eventually kind of an insurance-based model?
So it's still being billed right now. It's being billed as neuropsych assessment just in a primary care practice.
Mm-hmm.
But yeah, right. Like that would be the goal, is that because I think it's 77% of the population at Boston Medical Center is on public health, mass health. And so almost everyone is paying via state health insurance.
And will there be enough clinicians for this model to expand,
It's a really good question. I mean, at this point in time, there are not enough clinicians, right? And Sonia and I are both at William James College, who one of the main missions of William James is to really try to fill this gap, and to get providers, high quality providers in the field doing this work. I know Sonia and I are both very passionate about increasing access and working in these spaces. And so, that I don't have the exact numbers for general neuropsychologists, but I do know that the statistics on school psychologists are really grim. They are, I think the difference between what's being recommended for the number of school psychologists that are needed versus the actual number of school psychologists that are in districts, it's a really wide margin.
And Sonia, tell us a little bit about some of the things that you're doing to be the change. I know you have a private practice as well. You've been a clinician for a long time. What are some of the things that you do to try to help the community to kind of gain access to neuropsychological assessments?
Well, I think that most of the biggest thing I think is I'm working specifically right now with the Latino population because I'm trying to provide psychoeducation to them about the importance in the early age for the kids and do psycho evaluation. But again, this is the issue. I remember weeks ago, somebody called me and said, Sonia, I need a provider in Spanish for my son. So I was looking for different places until I find one. So this is what happened. I made the appointment. I talked with the person who everything was set up for the apparent neuro evaluation for this family. But when they go over there, they say, I'm sorry, I cannot do the evaluation because the insurance that you have is not going to pay for that. And then there was a family, they was crying, I don't know what to do, and try to knock a lot of doors, try to find some places. Unfortunately, nobody can do that. I know a person who she have a doctor, and she talked to me and she said, I'm gonna do pro bono that. But this is what happened. Even she did pro bono, sometimes that require that insurance pay. You understand what I mean? I know there's somebody crazy thing, but this is one of the things that I try to do. I would like to be that agency for change. I would like to advocate for my family, for Latino, for Black. I don't care. I would like to be there to help in there to understand. We can make the change. Don't stay in your home if you have a need, if your son have autism or have learning disability. We are here to helping you. So, yeah.
Right. And so what are some of the resources? I know that people are, clinicians that may be listening or, families out there that may want additional assessment for their kids. What should they consider? What are some of the resources that they can be looking at?
One of the things that I would say is, getting your name on wait lists, because it can be really long. Oftentimes that's a good way to go. I see many families who have their name on wait lists at 3 or 4 different hospitals in the local area. So that's one way to go. Sonia's compiled a wonderful list of Spanish-speaking providers that hopefully we can share with your listeners. And because it was just, she did a lot of work to get those together, right? Like it's hard to find, and Sonia found those. So I would say those are 2 of the things that you can do right away. Sonia, do you have anything else you'd add?
One of the places that I know in Lynn, this is a person that they are really, really faster to, they really care for the person or the parent. Always when I call, doesn't matter where they live, they try to find a place to, a way to helping the family. This is a Lynn, Dr. Hernandez, he's a doctor in in that area, and he really liked to help in the undeserved minority population and Latino. So if somebody is listening, if need assessment, please go and can call to Dr. Fernandez. They and the old people who work in very nice person.
And is there a light at the end of the tunnel for this disparities thing? You know, what can we do to help to reduce some of the disparities?
Like Dr. Turner said, don't stay quiet. Open your mouth, talk. And this is, as soon as I know Dr. Turner, I feel empowered. And I know now that I can speak. I have voice. I can go and say, you know what? We can make a difference. We need to be together, stand up and talk, advocate for our client. You know, because we have power. Sometimes I have a client, for example, they call it office. Oh, I'm sorry, I cannot listen. I cannot talk to you now or whatever it is. I just call and I say, hello, this is blah, 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 right away. So we have a power, and we had to use that power to help our community, to advocate for them.
So we have to speak out. We have to not be afraid to use our voice.
Yes.
And Dr. Turner is the person leading the course that both of you are in, that kind of led up to you being guests on this podcast.
Yeah.
Ellie, anything to add?
It was so funny because I feel like we're prophesizing Dr. Turner a little bit. One of the other things that she says in class often is, you're not going to solve world hunger, but you might be able to support people who are food insecure in your own community, or you may be able to go out and do something in your own community. And I think that's exactly what Sonia's highlighting. It's what, I think is the power of community health centers, and integrated primary care centers. I think there's a lot of power in really bringing care back to communities and having it be a place where you can go and you can see your primary care doctor, you can see a therapist, you can see a dentist, you can get your glasses, like really being able to integrate all of that. And maybe like your parents are like, it's a child getting seen and the parents are getting seen, and maybe the grandparents are getting seen and the aunts and being able to really integrate that is important for me. I think on a personal level in the queer community, I would love to be able to see, I think oftentimes the way that neuropsychological assessments are scored is based off of male or female sex. And there are new norms that have been created for many tests. So many of the ways that these tests are scored can be applied, whether or not you are biologically female or biologically male. But there's sometimes not an option for someone who might identify as non-binary, or someone, again, whose sex does not align with their gender. And so for me, I'd love to be able to continue to work with that community, my community of queer, and working with queer youth and their families, particularly when, again, you see increases in mental health problems when diagnoses, whether they're in school or when there's a delay in diagnosis across the board. Oftentimes that means there's a delay in access to treatment. And so, I hope that we can shorten that delay, get access sooner to be able to really get that treatment, get more clarity sooner.
Mm-hmm. Mm-hmm.
And as we kind of come to a close, is there anything else that you guys want to add that I haven't asked you today?
I just want to ask say something in Spanish. If somebody is listening over there and speak Spanish, or maybe you can translate to other. Hay oportunidades. Las mujeres, los niños, necesitan ser evaluados neurológicamente. No tengan miedo. Si no tienen seguro médico, busquen ayuda. Estamos aquí para ayudar. Así que, para adelante.
Great. Ellie, anything you wanted to add?
No, I just think, oftentimes it can take a long time to get these referrals, but stick with it. It's worth it. And it was great to be here. Thank you so much for having us, Dr. Williams.
And now I have one more question for you guys, and that is, I like to ask guests to my show to share one thing or to share something. It could be more than one thing, but to share something that you do for your own mental wellness, something you do on a regular basis, just to boost your own mental health and wellness, something you can share with our listeners. Maybe they can consider it for themselves. Sonia, what is one thing that you do just for your own mental health and wellness?
I love go in the night in front of the beach and look to the sky, all the stars. And that helped me to my mind.
So kind of at night, just looking up at the stars.
Yep.
Nice. I used to actually love doing that. I'm from Jamaica, and when I was in Jamaica, with a little bit less light pollution, I could see the stars just so well. And you could just literally look up and just see them so brightly. So I love that. Ellie, what do you do for your mental health and wellness?
Yeah, I wish I could see the stars in Boston. I love to go outside, take walks, get fresh air. One of the things I do the most that I really enjoy is gardening. When it's nicer outside, I can do that outside. But when it gets cold like this, I like to tend to some of my indoor plants, and I dry a lot of herbs, so those hang around our house. And I really like dogs, so I'll often walk around Boston, the streets of Boston, and just see whose dog I can pet. So that's another thing that usually makes me very happy. And I think people in Boston really like dogs. So if you walk around long enough, you'll find a couple.
Yeah. So, Ellie, you remember when I went to Kenya, Africa? I just get out and I just lay down in the grass just to look the star. I remember. So I went to Kenya to see them.
I bet it was really nice there too. Yeah, a lot less light pollution than Boston as well. So, but I also enjoy gardening, and I feel like there's just a lot to gain from just watching things grow. That horticultural therapy, as they say. So. But thank you guys for coming on the podcast today. And thank you to all the listeners out there for listening in. Remember this week to be kind to yourself, be forgiving, be generous to those around you. If you need a neuropsychological assessment, look into getting it, one for yourself or for your kid. Take care and have a great week.